Hello, I'm Sylvia, Chair Lady of JMHO, and I'm very proud to present my good friend, Dr. Carlie Grindney from Hong Kong and UK, right? Because you're locally bred in Hong Kong. Now, the reason I got Carlie to come is I believe Hong Kong has a lot of issues with mental health. I read something about 25% of people having some sort of mental health problem. Is that correct?
Amongst young people, amongst 15 to 24-year-olds, Hong Kong University did a study in 2023 which showed that 25% of 15 to 24-year-olds have had at least one mental health issue in the previous year.
I can tell you with the stress we are having, I think many lawyers have some kind of problem. I think it is worth, that is why JMHO, we have different panels. And one particular panel that I'm going to set up, and you are going to be joining, is mental health panel. Now with that in mind, I hope you can share with us something about the course that we mentioned, JMHO and Dr. Carlie. Yes.
Yeah, that's right. So I'm a medical doctor, but I also have a lot of experience in psychiatry, and I'm a counsellor, and I'm also a CEDA accredited mediator.
Yes.
So what we thought of doing was to put on a course of mental health for mediators, so that first of all we can explain more about what mental health issues are, the different types, and how to recognize them and what to do if you recognize them, because mediators are coming across very troubled people, especially in family mediation, but even in commercial mediation, it's impacting people.
Yes.
So that would be one part of the course, but also we were thinking that it would be useful to learn things to help ourselves manage the emotional load of working with people with emotional problems.
Yes. I think it is so important, especially with mediation, acting as a mediator, people coming in very stressed, and they could be in high dispute and very in need of equipping ourselves, mediator with all the skill, how to handle difficult people with maybe some sort of mental problem. So do you think half a day will do with the workshop or the course that we have been talking about?
Yeah, we're thinking about doing a half-day course, half of it covering mental health issues themselves and how to recognize them and what to do if you recognize something, especially something serious going on. And then the other half would be about our own self-care.
Oh, that's great. I think half a day, because we mentioned, usually think a day's course is more appropriate, but after talking, since mediators are equipped with the communication skill, maybe half a day will do. Of course, if people want to go deeper, we can always launch another half-day course.
We can, and absolutely, mediators already, all the active listening skills, all of those skills are very similar to what mental health professionals learn, if not the same. So mediators are already sensitive to what's going on with people, and I think this is just about giving some knowledge about different types of mental health issues to just back that up.
Great. Now, apart from this course, I am also, or JMHO, we have been launching peer mediation competition, because we believe that students, even when they are at band 1, they may face a lot of bullying happening at all the schools. And sadly, the parents are not aware, and the students don't go to the principals or the teacher. Although now they have some social workers, hopefully that will help. But still, I think much can be done there. So remember, we talked about maybe another course for principals and teachers. Can you explain a little bit?
You mean the drawing and talking course?
Yes.
So yes, besides being a mediator, I'm also a mental health professional, and we're setting up a mental health training company in Hong Kong, the Asia Wellbeing Institute. And our first course is a course called Drawing and Talking, which is to teach a mental health intervention to anybody who works with vulnerable people. You don't have to be a mental health professional, but it's to teach about trauma and boundaries and creating a safe space. And with this course, we're teaching people how to provide a 12-week intervention for people that you sense are troubled. If it's children, they might not tell you they're being bullied, but they might be behaving differently, and you can tell from their behavior that there's something disturbing them. And what you can do with this course is you have somebody trained who sees them once a week for 12 weeks for 30 minutes to just create a safe space for them where they can interact with you just the way they are, and then they draw, and we ask questions, just open questions. We're not analysing them, but we ask them questions about the drawing that allow them to express how they feel. And over the course of 12 weeks, they usually are able to process their emotions in the way they weren't before, and they move through quite dark emotions to lighter ones, and they come out lighter and happier and more able to express themselves and be more in tune with their feelings. So it's a really great intervention called Drawing and Talking, and we're doing our first course on Wednesday the 12th of February 2025.
Can parents do this, the 12-week with the children?
Probably not parents. It needs to be someone sort of slightly outside the immediate family to create this safe space which is not touched by anything that's already going on with the child. It could be grandparents or an aunt or uncle,
Grandparents.
or friends, or any health professional or school professional, teacher,
Helper?
social worker. If the helper is experienced at being with vulnerable people, and there's a good connection, then maybe. It's really about the qualities that person has, about being able to be with someone who's distressed and still be a safe person to be around. So they're not brought into the distress too, but they keep a safe space for this child to express within. And because it can be contained, that child learns that actually distress doesn't mean that everything falls apart. It also, we can work through it, and we can be with it, and things can get better afterwards.
Now correct me if I'm wrong. My understanding is this is the first course ever launched in Hong Kong, isn't it?
I believe so.
Wonderful.
Yes.
Yes. And we are also working, we talked about launching a course particularly targeted to the education area, right? So stay tuned. We have that in mind, and I hope that will really help people, especially the students. So all those in the educational field, please stay tuned because a course will be launched in Hong Kong. The first course. And tell us about the success in UK, and it happened, right? It's very successfully done.
So this Drawing and Talking course has been done in the UK for 22 years. Also in the US and in Europe, and there are thousands of schools, over 5,000 schools in the UK that have regular staff trained in being able to do drawing and talking with children, and there are thousands of children that have been helped. It's very popular amongst the schools that use it. There are some academies and pupil referral units, which is where people with behavioural problems can go, where every child is
you have a good heart to serve people in Hong Kong, Chinese people, and this video may reach people in China.
Absolutely.
And I believe that, especially for a long, long time, they have a one-child policy. Even now, they are not, maybe two, perhaps. So it's so important for them to reckon how vulnerable their children may be. And so having a course like this will be very helpful for them as well.
Yes, definitely. Yeah. It's like so in schools there's a 3-tier system of understanding mental health issues. This is tier 1. This is about helping children that are a little bit troubled to be able to connect better with others, and often this will be enough to just heal themselves and give them that connection with others, that they do not develop further mental health issues.
Okay, enough to get you interested. Stay tuned for JMHO's. We have a series of video like this, and thank you so much, Carlie. Bye.
Bye.